Hi everyone, my name is Julie Wanzik, and this is my intro for the Community Health Assessment Ideas. I live in Atlanta, Georgia, specifically right outside of it actually. I go to the Philadelphia College of Osteopathic Medicine, Georgia campus. It's just northeast of Atlanta. However, that's easiest for you to identify, the big city of Atlanta. I got my master's here in 2016, and the intervention of it's ongoing, which I'm about to tell you about. And I'm an MPH candidate for UNE in 2018. These are my last three classes of my MPH, and then I'll have my externship between my first and second year of the DO program here in Georgia. I'll do the externship next summer, and I'll graduate in May, a little earlier, and finish up this MPH. So I've learned quite a bit in this Masters of Public Health program, as you're about to see. So it's interesting, when I looked at my community health needs assessment experience, I realized that I was actually doing a preventative health, public health thesis. I knew it at the time, but I realize now I didn't always know the exact steps I should have taken, although I've already gotten a master's from it. Here's what I did. And my experience with community health needs assessments. So my master's was in assessing the benefits of a school-based yoga curriculum for teenage students at higher risk for certain factors. I assessed their psychological stress and the reduction of that via the hippocampal adrenal axis pathway that measures our cortisol, or it regulates our cortisol levels in our body, which is the stress pathway. I assessed the psychosocial benefits as well through questionnaires, and I applied this concept of adverse childhood events, that's ACEs, they're called ACEs out there in the social psych world, to assess the teenage populations that were undergoing the interventions, if yoga gave them tools that helped them through their ACEs in their life. If you want more on that, don't hesitate to call me, but that's what I did. And the analysis included data collection from peer interviews, the logic model, we did use that, I did, and then I had some people under me that helped me with this thesis. The socioeconomic status was key, and that's how I targeted the individual schools that we did the intervention at. And I did a SWOT analysis, the strengths, weaknesses, the opportunities and threats, both internally and externally, and how that played into a school-based curriculum. The intervention is ongoing. I worked with the Atlanta yoga movement specifically. I reached out to them 3 years ago and asked them if we could do this study as well as this intervention for high-risk schools that had a lot of ACEs, that adverse childhood events in their populations. So that's my community health assessment risk. So what I hope to get out of this course and learn further is how to do a concise CHA. As I mentioned before, I'm becoming an osteopathic physician, and what I really want to do is be able to disseminate what a good CHA is to help my patients both reach and obtain the best resources for their well-being and their health. So that's what I hope to get out of this course. Here are my ideas. As you know, I've already done a CHA and geared towards an intervention for my thesis, but here, what I really want to do for our 12-page presentation at the end of this class is one of two ideas, and I really want your feedback about it. I have the opportunity to focus on the Native American tribal health research shortage and impact via I'm about to go to South Dakota in October. It's kind of late, but I do have the connections to do interviews and assessments before then, but I'm really interested in their research shortage and the impact it's making on the Native American community, and therein is socioeconomic factors that will definitely be played in, and I'll weigh that out in the logic model in the next couple weeks. The second idea is my medical school student population, their physical and their mental health assessment and impact. There's a couple of ways I can slant this, and I want your feedback from both our professor and my classmates. I can do the psychosocial and do stress reduction, and there's a high suicidality and suicide ideation, which thoughts of suicide in the medical student population higher than the regular population. And so I can look at that, as well as I can look at health parameters such as our diets and the stress levels, because we don't eat the best. We have to preach it, but we don't do it. So those are my 2 ideas, and I really would like some feedback on what you guys would like to see, because I can go either way with this, and I'm slanting more towards the Native American tribal health, but I can certainly make it easier on myself and interview people at my medical school. But what do you think? What do you think, guys? And I'm going to use the CHA criteria that we got out of one of our videos, and I should have cited this. It's from the What is Community Health Assessments from this Module 1. And those are the 5 points that I'm going to be looking at: the urgency of the need, the concern and the awareness of the issues. That's why I thought of Native Americans, and the presence of the interventions, the severity of the problems that unique communities face, and then the magnitude of the problems. So I really am looking forward to your feedback, and nice to meet you, and I'll see you in class. Thanks, guys.